It's May 4th, 2020, 6 p.m. We're here with a remote meeting for the Board of Health of the town of Northborough. I'm going to announce the following. This open meeting of the town of Northborough is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth of Massachusetts due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, the town of Northborough has been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. All members of the town of Northborough are allowed and encouraged to participate remotely. The order allows the town of Northborough to meet entirely remotely. Well, this is the town of Northborough Board of Health, to meet remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Public is encouraged to follow along using posted agenda unless the chair notes otherwise. Members of the public who wish to view this meeting may do so by turning into cable TV government channels, Verizon Channel 30 or Charter Channel 192, or by live stream, or by visiting the town's website and going to the Department of Cable Access Television and click What's Playing Live. Ensuring public access does not ensure public participation unless such participation is required by the law. This meeting will not feature public comment. Let's see. Confirming member access. The chair confirms that the board members and persons anticipated on the agenda are remotely present and can be heard by stating the following. Members, when I call your name, please respond in the affirmative, indicating your presence. Dilip Jain.
Here.
Swati Sani.
Present.
Teresa Capobianco.
Present.
We have Fire Chief David Parenti. Fire
Sorry.
Chief David Parenti.
Present, I was muted.
Sorry. And we have Town Administrator joining us, John Coderre.
Present.
And we also are introducing tonight our interim health agent, Dennis Costello.
Present.
All right, all present. Mr. Coderre, have I missed anybody on that?
Nope, I think you're good.
Okay. With that said, we're here to take care of a couple matters. The first being introduction of Dennis Costello as interim health agent.
Sure, Mr. Chairman, do you want to approve your minutes before we get into that? Or you
Yep.
want to do your minutes afterwards? It's up to
No,
you.
we'll do the minutes now.
There we go.
We have minutes from January 14th, 2020, which need approval. Would somebody please move to approve the minutes?
I'll move to approve it.
Somebody second that, please.
Second.
All those in favor?
Aye.
You need to be, it does need to be a roll call, Mr. Chairman.
Okay, it needs to be a roll call. We'll get it. Dr. Jane?
Approve.
I approve. Ms. Sane
I approve.
and Ms. Capobianco.
Approve.
Minutes of January 14th, 2020 will be approved as recorded. Going to the minutes of April 14th, 2020. Will somebody please move to approve the minutes?
I move to approve the minutes of April 2020.
And somebody second that, please?
Mr. Chairman, it would be April 14th.
April
2020.
14, 2020.
Second.
We need. Second,
Second.
all those in favor, we've got Delete,
Approved.
I approve, Swati,
I approve.
and Teresa.
Approve.
Very good. The minutes are approved as recorded for April 14th, 2020. All right. The third issue on the agenda for this evening is discussion and vote regarding potential emergency order to require a mask or facial coverings in certain places. This was something that the town and the board had started on, and then the governor on Friday placed state regulations in place. Mr. Coder, I'd appreciate if you could take this issue and expound on it as to procedures and what's gone on.
Sure, it'd be my pleasure, Mr. Chairman. So first of all, I appreciate everybody trying to get used to this new environment. It's a little bit different. I'm a face-to-face person myself, and so it's hard to conduct business in this remotely, but we're all getting used to it. The need for a little bit more clarity and formality. We're working with other boards and committees to kind of work through some scripts. There are things and disclosures that we need to make at the beginning. All votes need to be done by roll call. So any actions this evening by the board needs to be done by roll call. And this is part of the new norm for us, at least for the foreseeable future. So in terms of your agenda this evening, maybe it's helpful for me to back up and provide a little bit of context for you. So the issue of face coverings, masks or face coverings of some kind, has been debated and discussed pretty widely since the outbreak of COVID-19. And it's only within the last week that you've seen a couple of communities start to pass a Board of Health order requiring face coverings. And the reason for that is pretty straightforward. So back on April 15th, the Attorney General's office issued a legal opinion, an advisory to municipalities. And it was regarding a whole host of authority that we have to manage this emergency. One of the things that the Attorney General's office weighed in on was facial coverings. And at that point in time, the opinion was that they could be required or requested on an advisory basis only, but could not be mandated. And so if you are following along, the governor again issued an advisory to wear face coverings, and a number of communities followed, but nobody issued an order mandating them. And so we've all been following the lead of the governor's office and the State Department of Public Health. Now, what's changed is on April 27th, the Attorney General's office issued a revised or an updated advisory. And in that, she notified municipalities that they could, in fact, require or mandate facial coverings. So what you saw was last week, a bunch of communities take up this matter and move. And so the question I'm sure many folks in the public have is, why did this not happen sooner? And then why all of a sudden are we all talking about this? Well, it was because we were advised that it wasn't something that was appropriate that we could mandate. And so with this new advisory, which just transpired, Monday of last week, you all know we contacted you within a couple of days, and we had been working with town council. We had scheduled this meeting for this evening to take up this potential vote to require facial coverings. And we've been working with town council to make sure that the language was correct and to package this up for your meeting this evening. On Friday at 1:30, the governor issued COVID-19 order number 31, essentially preempting what we were planning to do this evening. Now, this is, in my opinion, a positive thing, because one of the issues that we've faced throughout this response to COVID-19 is the fire chief participates in weekly updates from MEMA, Massachusetts Emergency Management Association. I participate in weekly updates with the governor's office and all the managers across the state. We were being told and advised very clearly from the state that they didn't want a bunch of communities going off in different directions. And they respectfully asked us to follow their lead. In particular, when they issued their guidance regarding access to food and pharmacies, the lieutenant governor specifically asked us on our conference call not to approve more restrictive measures, that they're working with a very good group of experts and that they're relying on those experts to provide advice, and that's what they would like us to follow. And so we have done that. And frankly, I think it served our community very well. And what you don't want to have in these situations, if you can avoid it, is a face covering required in Northborough, and then you walk across the line into Westborough, and it's a $300 fine or vice versa. And so, again, we were advised that this isn't something that we had the legal authority to do. So when that changed last week, we moved very quickly. This body and this meeting was called within the limits of the open meeting law, and we were going to take this up. So I'm happy to report tonight the governor on Friday took the lead as he's done throughout this emergency, and in my opinion, he's handled things very well. And we have been in lockstep with the governor's office and DPH and the CDC in our response. And I think it served the town well. So in terms of this evening, we originally posted, and on Friday, I didn't even send you the draft order because basically it looks almost exactly as what the governor issued on Friday. And what it covers is any member out going into a business, an essential business that's open to the public, you're required to wear a face mask covering of some kind. It doesn't need to be. In fact, they specifically are recommending that you not use N95 masks, which should be reserved for first responders and health providers. So any kind of a facial covering from a bandana to a dust mask is appropriate. And the whole concept here, and I'm sure I'm speaking to the choir here with the Board of Health, but as the governor stressed again in his press conference today, it's not just for your protection, it's for everybody else's protection. So it's if I'm wearing this covering and it prevents me from infecting somebody else, and if everybody else is wearing a facial covering, it prevents them from infecting me. It only works if everybody's wearing them. So if you cannot social distance outside, you should wear one. If you go into a building or a structure of an essential service, a grocery store, a pharmacy, a hardware store, you have to wear one and the employees have to wear one. And one of the things that we've heard, and again, we're getting some, continuous feedback from the public and questions. And one of the questions was, why aren't you requiring particularly large grocery stores to make their employees and anyone entering those stores wear a mask? And we've had conversations with those facilities. And what they're waiting for is for the governor or for the Board of Health to mandate that. So we're here. For whatever reason, we could not do this sooner. Keep in mind, too, that there's a lot more information out there in terms of how to make a mask. You can now get on Amazon or some other online procurement, and you can buy surgical masks, not N95 masks, but surgical masks and other appropriate coverings. So the availability of coverings and the information on how to make appropriate coverings at home is out there. And at this point in time, again, based on the latest health information, it's prudent and makes sense to have everybody wear these face coverings. And so that's essentially what the governor's order does. If you're in a public transportation or a ride share, you also need to wear appropriate coverings over your mouth. And this is the way we're going to basically keep people safe moving forward. But I just want folks to know we weren't in a position to do this any sooner than we were planning to do it tonight by a matter of a day or two. And again, the governor, I think, as part of his plan to in a phased approach, reopen the economy, this is going to be a prerequisite. In order for people to move about safely in confined areas, everybody needs to wear an appropriate facial covering. Just by way of reference, the governor has appointed an advisory committee that will report back on May 18th with a plan, not a, on May 18th isn't a magical date where the economy is just going to open back up. But on May 18th, they're going to issue their report, which is going to have a phased recommendations for how segments of the economy can start to open up. But I think the governor recognized and DPH recognized that a prerequisite to really anything opening up further than it is that everybody needs to wear an appropriate face covering. So in terms of this evening, we're not recommending that the board or the local board of health adopt its own. We would like, and as has been recommended by the state, that everybody follow the governor's order, recognizing a couple communities that met a day or two before we were scheduled to meet, have adopted their local order. But basically, the governor has done what we were planning to do this evening. So the recommendation of the staff would be that to follow and to implement the governor's order. To that point, there is one action item that we are requesting. So the police chief did send to you a memo indicating his recommendation, because the governor's order says that pursuant to General Law, Chapter 111, Section 30, authorized to enforce this order, and may do so with the assistance of state and municipal police. So like everything we do, we want to be explicit. And so what we're asking of the board this evening is a motion to authorize the police department to be your agents and enforce the governor's order to make sure that folks are wearing appropriate face coverings. Now, having said that, like most public health initiatives, our goal and our intent is compliance and public safety, not to go out and start writing tickets. So the intent would be to issue a verbal warning and have a graded fine up to the $300 that's is allowed. But and just so I'm clear to any members of the public that may be watching, please do not call 911 to report somebody who isn't wearing a face covering. This is routine. Our goal, it's just like if you have kids playing basketball, the police will go out there, they'll talk to them, explain to them the importance of social distancing and the importance of wearing face covers. And that's how we're going to get through this. It's not going to be by, writing tickets on site. I like to think that we've done an excellent job getting this information out. It's hard to avoid not knowing that face coverings are required. And by the way, this is effective on Wednesday, May 6th, so 2 days from now. So people have time to either purchase or make appropriate coverings. And then our initial goal is going to be just constant public education and information. Because again, the goal here is compliance. It's not enforcement. It's the goal is to get people to do things to protect themselves and others. So I know that was kind of a long explanation, but we had quite a bit that we were planning to do tonight that was preempted by the governor. So in terms of the staff, we're here to answer any questions regarding the governor's order or the enforcement. But as far as action items by the Board of Health on this agenda item, it would be a motion to designate the police department and the police officers as your enforcement agent under the governor's order. So with that, I'll defer back to the chairman, and certainly we can answer any questions that the Board of Health members may have.
Okay, I'm going to go through the ranks and ask if anybody on the board has any questions or comments. So Dilip Jain, do you have any questions or comments?
Yeah, I have two questions. What about those communities that have veils or face coverings? Do those count as the real face coverings? People who wear veils, burqas, things that cover their face, which I guess is a cloth covering, are they going to be counted, number one? And number two, it says for social distancing, does that mean that trails are going to be also part of the hiking trails, parks? Whenever they go out there, they have to wear face coverings when they go on the hikes or walking the dogs along the roads, etc.
So let me take the two questions. As far as an appropriate covering, I don't. I guess it depends on the veil, but the idea is it should stop your breath from coming through. So cloth bandanas, dust masks. If a veil is sufficient to prevent your breath from coming through, then that would comply. As far as the outdoor, that's an excellent question. And the governor has been a big proponent of leaving outdoor resources available to folks. He has spoken almost at every press conference at his desire to allow people to recreate outside. And so if you're outside and you're walking your dog or you're hiking a trail, you would not be required to wear a face covering unless you're in a situation where you can't abide by appropriate social distancing. So even if you're in an outdoor venue and like say a farmer's market and you can't maintain social distancing, then you should wear appropriate face coverings. But as far as the trails or people running on roads and things of that nature, the idea is that as long as they can appropriately social distance, that they would not be required to wear a face covering.
Thank you.
So, Mr. Coder, this is Chairman French. If you're in an open area, like sitting in the park, and you can't maintain social distancing, is it should or must maintain social distancing or wear a mask? If you're outside in the park, I know that New York City was ticketing people all weekend because they were all sitting and chatting like like nothing of this was going on. So as far as I can tell from Governor Baker's suggestion or bylaw now order is that there's no requirement for social distancing.
Yeah,
That you
I
can
think the
get written
governor.
up on.
Yeah, I mean, I think the governor's been pretty clear about this. You know, the idea is to be smart and to be safe and to gain compliance and to educate the public about what's necessary for them to be safe and for the safety of others. And so the idea is that you should be maintaining at least 6 feet. We're not sending the cops out there with a 6 foot piece of wood to make sure that people are, are maintaining that distance. And then if for some reason they can't, that they're getting a ticket. So the social distancing
Okay.
is what you should be following. And if you can't do that, you should be wearing a face covering. And we're trying to keep out of the weeds of this. And really, it's about education compliance. Mr. Chairman, I just want to let you know,
Yes.
as is unique, I'm looking at something on my laptop that says it's going to reboot on me in 3 minutes. So
Oh.
if I disappear, I will
No.
log back in.
No.
The trials and tribulations of remote access. I can't get it to. I cannot get it to
All right.
stop.
Thank you, John. I'm moving right along.
So if I disappear in 3 minutes, that's where I'm at.
Come back. Swati?
Yes. So my question is it for 5 years and above, the requirement to wear a mask? I thought I had read about 2 and above. So
I read 2 as well.
Yeah. So there's been the governor has indicated that DPH is going to issue some more advisory on what to do for children's between 2 and 5. And so there's also going to be some more information from DPH regarding that. But you're not supposed to put it on children below the age of 2, anybody who can't remove the mask themselves, and then requires generally folks age 5 and over to wear some sort of face covering.
Anything else?
does it contain a list of the public places? Like, is there a list of what is deemed as public place?
So any building or essential service that's open to the public.
Okay.
That's it. And then any other public places, anywhere else that you're allowed as a member of the public, parks, sidewalks, streets, things of that nature. And by the way, just I know you're aware of this, but our playgrounds, the structures themselves are closed, the fields are closed. to any activity of organized sports. And so, if two siblings are out there and they're throwing a frisbee or sitting on a blanket, again, we're trying to use common sense here. People are stuck inside. They're going a little stir crazy. They should be able to hike on our trails, walk around the track, get some exercise. But again, we want them to be safe, maintain social distancing, and wear a face covering if you can't do that. So,
Okay. Thank you.
And Teresa Capobianco, do you have any questions or
comments? No, thank you.
very good? All right. Well, with that, Dennis, do you have any questions or comments? Dennis Costello?
No, I don't think so.
All right.
Nice to be back.
if Mr. Chairman, if I may, since my computer says it's going to reboot on me in about 45 seconds, so if I disappear, I'll log back in. But I did want to, on the agenda is introduction of Dennis Costello. Dennis is I've appointed Dennis as our interim health agent. Casey Mellon, our regular health agent, has separated from the town. He's taken a position elsewhere. Dennis Costello is, I've used Dennis probably 3 or 4 times. He covered all of the maternity leaves from our prior health agent. He covered the transition from Jamie Terry to Casey. So he's familiar with the town, and Dennis has been a great asset for us. He will be our interim health agent until further notice. My computer is going to reboot in 2 seconds.
Welcome. Welcome, Dennis.
Thank you. Thank you.
Nice to meet you, Dennis.
Same here. And someday in person.
Yes.
Someday.
Hopefully soon.
Whatever that may be. Whatever that may be. I don't know if you have any questions for me or.
No.
So what does this definition of interim mean? Temporary until what?
Until you hire somebody, I believe. I believe.
For the foreseeable future.
Yeah, that's up to John. I don't know what if they may change the position or what the town would like to do.
So that means that for the present time, you're full-time for the town of Northborough. When the town opens up again, you'll be coming to the meetings?
I am here part-time. I work in the town of Boylston as their health agent. I am part-time there. However, more and more time is spent on COVID-19. And I do septic inspections for the town of Southborough.
Okay.
So my time is limited, but I think there's a lot of things that I do in my normal course of a job that also pertains to all towns. So it's kind of like I can use my expertise here the same as I do in Boylston. And I believe there's also a couple of different entities that the town of Northborough needs to keep a presence at, which I am involved in town of Boylston. Region 2 being one. There's a new region that came out during this pandemic. They split Region 2 into smaller regions. I'm not sure if you're aware of that, but for funding issues. So there's quite a bit of interaction that can be done without costing a lot of time. So I'm fine with helping out. What we all should be doing anyway. So.
Okay, very good. Chief Parente,
Yes.
just make sure you're still with us now. Any comments, concerns?
No, none at all. I think looking forward to having Dennis on board. I've been working with our VNA, keeping track of all the reported cases and keeping everyone up to date on that for the first responder notification. That's been going very well. And I've been running way too many Zoom meetings, but hey, you learn as you go. But that's okay.
You'll be a professional by the time it's over.
Otherwise, our guys are keeping busy. They're doing a great job, and everything's going well.
Good, good. All right, with that
John's
said,
back. Hang on a second. John's back.
good.
John is talking. No, you're not.
Well, I'm here. Can you hear me?
I can
Yes,
hear
we
you, but I
can.
can't see you.
Hey, you look better.
Yeah, yeah.
Yes, I know. You gotta, you gotta love, you gotta love technology.
There
There
he
you
is.
There you
are.
go.
All right.
I love it. It's like it was a countdown. So like the meeting is, on a time set. I'm watching it. I'm watching it. go
Had
down.
I known.
So I apologize for that. But the good news is, in terms of the coverage for the Board of Health, I just want to be clear so everybody understands that we're in very good shape. So Dennis is a part-time health agent in Boylston. Dennis is covered for us, very familiar with the town, familiar with the businesses and with our administration. We've worked together, I want to say, on and off, Dennis, for about 10 years. So
Hey,
we
more than
also
that.
have
Yeah.
Bill Fisher. Bill Fisher is a retired health agent who works for us on a contractual basis, and he typically does the food inspections. So Bill is available for us as well if we need him to do other things during this COVID-19 pandemic. And then last but certainly not least, we have Ann Labonte, who is our public health nurse. Ann is responsible for doing all of the COVID-19 tracking and tracing. So Ann continues to do that work. She is working closely with the fire chief and myself. So we know when we have new addresses, if there's a positive test, public safety is aware of that. We'll get Dennis into that communication loop as well. So we're covered, and we're going to be fine. And I know at your last meeting, the fire chief did an excellent job of explaining the protocols that we've put in place as a town with regard to public information. So despite the fact that there were a number of releases that were going out that said Northborough Board of Health and it had our former health agent's name on it, every bit of communication that's gone out is vetted by the police chief, the fire chief, myself, Board of Health, superintendent's office, and several other folks. And this way, we've made sure that the information is consistent, that it's accurate, and that it's being put out on a regular basis. So that hasn't changed. So any announcements or public information that needs to go out with regard to COVID-19, we'll continue with that protocol. Dennis will just now be a part of that instead of our former health agent. So I just want to assure folks that all the bases are covered. And as I said, we're in good shape. And if anything comes up, we have personnel that can address and manage whatever need arises. So I just want to assure the Board of Health that we are, as I said, we're covered and we're in good shape. And our public health nurse is really the point on this. Ann is bearing the brunt of the work for the contact tracing. It's a very labor-intensive process, as I'm sure you're all well aware. So through the chair, Chief, I don't know if you have anything that you want to add, or Dennis, if there's anything that you would like to add to the state of affairs.
No, I think I'm good. I'm still feeling around a little bit.
I did want to mention publicly through the chair again, if I may.
Yes.
Despite the fact that at every selectmen's meeting, we give a COVID-19 update, the last selectmen's meeting on April 24th, we had brought in the executive director from the Quarter 9 Chamber to explain all the resources that are available to businesses. We also had the Family Services Director and the Senior Center Director in talking about information and resources that are available and to the public. And at every meeting that I'm at, I make this statement, and that is, if you or anybody you're aware of needs help or assistance obtaining food or other critical supplies, please call us, contact the Senior Center, contact Family Youth Services or my office, and we will make sure that we put you in touch with the folks that you need to get the resources that you need to be safe. And that has been consistent message throughout this and will continue to be our consistent message moving forward. On Thursday, May 7th, the Board of Selectmen is holding an informational meeting. So it's to provide information to the public regarding our response to COVID-19, but also to allow the public to ask questions. And so we have set up a email address dedicated for this meeting, and it is covid@town.northborough.ma.us. That's covid@town.northborough.ma.us. If you send your question to that email address, it will come to our office, and we are compiling the list of questions. And then on May 7th, we're going to do a presentation and answer all those questions. If you'd like your question to be answered, it does need to be submitted by close of business on Wednesday, the 6th, and then we'll make every effort that we can to answer those questions. Again, I think a lot of the stuff has been answered. Probably the most prominent question and the most anticipated question is, will the Board of Health in the town of Northborough require and mandate face coverings? I think we've answered that this evening, and I imagine that's probably the most burning question that's out there. So, but I do want you to be aware, Glenn, I've spoken with Glenn French, the chairman. He's going to participate in that meeting on behalf of the Board of Health. We'll have representatives from the school department. Dennis Costello, the health agent, will be there. The chiefs will be there. I'll be there. And the Board of Selectmen. And the idea, again, is just about providing information. And the last plug that I'll make is any bit of information that we've released is included on the town's dedicated COVID-19 webpage. It's prominently displayed on our webpage. If you click it, there's all sorts of information, and any releases by the public Board of Health, my office, or the governor has all gone out on that webpage and gone out through town news. I know it's a lot of information, but every venue that I'm able to speak at, I want to make sure people know where to find the information that they might be looking for.
Very good. Thank you, Mr. Coder.
Mr. Chairman, I just speak for a moment?
Yes,
And I know you asked me before, but it just came to me. I forgot I wanted to mention this.
this is the Chief
Yes,
Parenti.
it's Chief Parenti. Normally, Chief Liber mentions this, and together we've discussed it many times. And that is, our call volume, both police and fire, is way down right now. And our concern is people are unwilling, or not so much unwilling to call us, but don't want to bother us because they think that we're too busy dealing with other issues. Please don't wait to call us. If you have any medical issues, if you're having any issues that you need the Chief Liber or the police department for, please reach out when you need us. We'll be there for you. That's what our job is. We're concerned we're going to be transporting some very, very sick people as opposed to just some sick people. So please take the time to call us. Please take the time to contact the police. There's ways on the police department website that you can submit concerns, and they follow up immediately with that. So please take the time to do that. Thank you.
Thank you, Chief. All right, well, the only thing we haven't done, I believe, is move on the board vote regarding
Making the police your agents.
wearing, yes.
Yes.
Facial coverings and
I'll get it in a moment. In any event, I'd like one of the members of the board to, if they would, state their name and make a motion.
I'll do it.
Thank you. The board
Teresa.
recognizes Teresa Capobianco.
Thank you. I move that the board vote to the provisions of the governor's executive order 1/2020 regarding the wearing of face coverings in public places, the COVID-19 Order 31, the provisions of Section 30 of Chapter 111 of the General Laws, and all other enabling authority to ratify and confirm that all officers of Northborough Police Department are authorized to enforce the order in accordance with its terms, including the issuance of civil penalty citations for violation.
Very good. Somebody second that, please.
I seconded.
Very good. Swati seconds it. All those in favor? Dr. Jane,
approve.
Swati,
Approve.
Teresa,
Approve.
and Glenn French, approve. Motion
Excellent.
passes. Unanimous. And I think that's it. Is there anything else, Mr. Coder?
No, I just, again, refer anybody interested in information regarding the town's COVID-19 response to please go to our webpage. It's very comprehensive. And again, if you have any other questions, that covid@town.northborough.ma.us email address is active. And if you send your question in, we'll do our best to answer it on Thursday. Unless you're asking me when everything's going to open back up again, in which case I'll answer that one now. I don't know, but we're working on it.
Very good. So that meeting is May 7th, 6 p.m.
Yes.
Excellent. With that, is there anything else from any of the board members?
All set. Stay
Very good.
safe and be well. And wear your
Thank you.
face coverings when you're out.
I move that we end the meeting and till such time we meet again.
I second it.
All those in favor?
Roll call vote. It'll
Very
need to
good.
be it'll be a roll call vote, Glenn.
So,
Your motion to
all right,
adjourn.
all right.
I know
Okay.
this is, it's tough to get used
I'll
to,
get
but
it. I'll get it.
just
all
for the
right.
record, because it's not always clear, everything
got
needs to
it.
be a roll call.
We go through it. Dilip Jain,
Yes.
Swati Sane.
Yes.
Swati, I'm sorry. I always call you by your first name. How do I pronounce your last name? For the record.
Sane?
Sane. So I have it right. Teresa Capabianco.
Approved.
That's it. And I approve as well. Glenn French. How's that?
Perfect.
We'll get better, John.